Hello everyone, I'm Stephan. The coronavirus has been infected to a lot of people all around the world. The positive cases of the coronavirus have been found in Myanmar too. Now the people in Myanmar are afraid of the COVID-19 and they are worrying about COVID-19. And there are also a lot of misinformation about COVID-19 being shared on social media. That's why Myanmar Times prepared this interview with Dr. Stephan for Jost, the representative of the World Health Organization WHO Myanmar, to explain about how to stay safe from COVID-19 and how people can be infected with this virus and what should we do if we are feeling unwell and the other facts that we should need to follow. So we have Dr. Stephan for Jost, and hello.
Hello, Minglaba Khmer.
Minglaba. So what is the mode of transmission of COVID-19? How does it easily spread?
First of all, thank you very much for inviting me. Much appreciated. The novel coronavirus, or COVID-19, is transmitted through very fine respiratory droplets. They're carried through the air, but they're actually fine droplets that people who have the virus would emit. Originally, actually, it's an animal virus coming from an animal source. So we need to take care for both, not to, if you like, deal with wild animals, but at the same time also prepare and prevent infection from the fine droplets that may be carried by people who have the virus.
Okay, let me know about current updates or treatments for COVID-19 and pandemic disease.
Well, currently there are no known treatments for COVID-19. It's a new virus, a new disease, and 3 months ago we didn't know it was there. So therefore we can't rely on treatments to cure the disease. At the same time, there are, of course, at great intensity, scientists all around the world are trying experimental treatments to find out what could help. At the same time, none of these are as yet matured as treatments. And the World Health Organization is, of course, looking at this very closely. No treatments as yet are pre-qualified by WHO. So therefore, we need to emphasize prevention and preparedness very, very much. At the same time, of course, some supportive treatment can help. So case management is important, but there is no cure in terms of the medication that can so far be provided.
Yeah. How can we avoid getting infected? I prefer grassroots people. They have to used to go to their workplace by using public transportation like YBS or train. Any advice for them?
Well, it's important to practice social distancing. And if you are in public transport where that is difficult, then really make a decision in consultation with your employer whether work from home is possible. So try and practice those different measures. Also, if you are in a train, I mean, open the window. I mean, if this circular train, I think in Yangon has open windows, which is very good. And it helps, normal ventilation will also help very much in this regard.
Okay. Are famous affected in protection against COVID-19? Let me know your key messages for public about precautions.
Well, as mentioned, social distancing very important. Wash your hands frequently with soap and water. Observe good cough etiquette. Avoid contact with wild animals. And if you have, wash your hands again quickly with soap and water. Avoid crowded places, and which is already, I think, controlled quite a lot, rightly so, by the authorities. And if you are not well, if you have difficulty breathing, shortness of breath, and fever, and cough, dry cough particularly, contact a health provider, initially by phone is best, and tell your travel history also. And therefore, try and be alert and stay in good health. Now also in the hot weather, keep yourself well hydrated, that's important. and have a balanced diet with lots of fresh fruits and vegetables. These things help. If you smoke, stop smoking. Quit smoking. Very important, because we found that many suspect cases are actually heavy smokers. So lung health is impaired by smoking. So stop smoking if you smoke. It'll help you and your loved ones very much to cope both with this crisis and other problems that smoking is causing.
So can you talk about the face mask effective, the face mask effective in protection against COVID-19?
Well, wearing a face mask will not protect you, but it will help protect others if you're not well. And you may not have COVID-19, you may have an ordinary flu or a cough. It's not a crime to cough. But then wear a face mask to protect others from the fine droplets that may carry either this virus or others that you may be affected with. So that is an important principle. Don't wear a mask if you are well. And in any case, the viruses are so small that wearing a loose mask will not protect you from getting it. But if you are not well, it will protect others to some extent by keeping it in the mask.
Okay. Is there any vaccine against the virus? How long will it take to develop a vaccine?
A vaccine? Well, there is no vaccine as yet. It's a new disease, as mentioned. It will take time to find the right approach for candidate vaccines to be developed. The good news is that within 60 days of the Chinese authorities sharing the genetic sequence of the virus, this novel coronavirus, a first trial has started for candidate vaccine. But of course, it needs to go through the rigorous checks of quality and effectiveness. And we are still quite a long way from that, naturally. Normally, a vaccine takes 10 years to develop. And if you fast track it, pulling out all the stops, maybe 1 year. Now, we are being in an unprecedented situation now. The scientists around the world work around the clock for this. Maybe we can shorten it further to, say, 6 months or so, which would be unprecedented. But don't rely on a vaccine now. We need to do the right measures now in order for people to not to contract COVID-19 to the extent humanly possible. And that in all countries of the world, in Myanmar and elsewhere. It's very important. This is a global problem now. It's a pandemic, as it's called. It's affecting the entire globe. There's no room for hiding for anyone. We all should try and do the right things. And the right things are to protect yourself from falling sick by observing the good hygiene measures. Washing your hands with soap and water, and the other things I've already mentioned. The right thing is also to put up a strong public health response, which the country, Myanmar, is doing, and is on high alert and has been for some time already, early on in this COVID-19 situation. And we need to help each other. Very important too. The solidarity is key between countries, within countries, and among ordinary people. Solidarity is the key thing to help overcome this global crisis.
Okay, so we saw the news about Korea and Singapore were donating the test kits to Myanmar. So how many test kits do we have, and how many times does the test kit take to confirm the result of coronavirus?
Right, thank you also for that question. We have currently sufficient test kits to do the work necessary as at this moment in time. But of course the situation is very fluid and is changing very rapidly. We need to ensure that there are also test kits coming in future. And for that, it's important that the sea lanes and the air traffic remains open to some extent and not closing down. Otherwise, how will test kits get here? So the cargo needs to be protected to come in, and also other flights still should keep, some flights should keep running at the same time. So we have enough for now at this moment in time. And I would like to thank the authorities of Singapore for having donated 3,000 test kits, for instance. Other partners also I would like to thank. USAID and others. WHO also has already made some test kits available. There's more on the way. The UN system is pulling resources together, and UNICEF, UNOPS, WFP, they're all coming together to procure more test kits. That's very important because we need to keep testing now all the suspect cases and people who are in quarantine, at least many of them, and to make sure that we find cases early and isolate them, detect their contacts, follow that through also, implement quarantine, and make sure that we look after the cases that have been found.
Okay. According to current situation in Myanmar, should government need to order an announcement for the public staying at home and working from home? Let me know your views on that.
Well, these are national decisions, and we wouldn't prescribe from WHO how best to do this. At the same time, what has been very good with Myanmar is the proactive approach. The proactive nature for strong public health measures, and the proactive nature is very important. It's likely to be too late if we wait for cases to accumulate. But Myanmar has not done that. Myanmar has not waited for things to happen. Myanmar has taken action in anticipation of cases. And that was very important, to strengthen the surveillance and keep strengthening it. We've also benefited from the strong public health actions that China has taken.
And the people in rural may know about the COVID-19, but they might not know about how to protect the COVID-19. What should we do? What should we do for them?
Well, it's important to get the message out there. The national health authorities are doing that. Many partners are doing that, but it's not enough. It needs to go beyond that. And that is also, I believe, why we've had the national address to the people by Madam State Councillor last night and also a week earlier. And that is great. We need to keep getting the message out there, how people can protect themselves in this situation. And it's important that we say so whenever we now speak and make sure that the message gets out there. We all need to help with that, make sure everybody is reached. Many partners are contributing, also translating the key messages, prevention messages in the different languages in Myanmar. Very important that we reach everybody, because everybody will help contribute to the success of this collective endeavor. And it goes beyond Myanmar, of course. It's a global issue, a global pandemic.
Yeah, okay. So is there anything else that you want to say to the people in Myanmar about COVID-19?
This is the moment for solidarity, not stigma. We need to help each other get through this, all of us, individually and collectively. It's important to help each other, maintain social distancing, practice the prevention measures that the Minister of Health and Sports and many others are already putting out there. Individually and collectively, we will determine the outcome of this. So therefore, help each other. It is the most important thing to do. Maintain social distance, but keep hearts close together. Social distance does not mean social coldness. We can all overcome. Yes, we can. I forgot to mention our WHO newsletters that we also contribute to this. They are, of course, on our Facebook fan page for WHO Myanmar and also the website. This is the Myanmar version of it. And the practicing the prevention advice, it is clearly also mentioned there. We have the same in the English language. They're out here. The figures, of course, they change every day. Don't worry that much about the figures. There is a long way ahead. It is not a sprint. It is going to be a marathon. But with everybody's help, we can prevail.
So this is today's interview. Yeah, thank you for coming here and telling us about this COVID-19.